In long-term ulnar nerve palsy, patients will develop a permanent deformity in their hand called the ulnar claw. Now, the ulnar nerve supplies the lateral two lumbricals, and the lateral two lumbricals cause flexion at the metacarpophalangeal joint of the ring finger and the little finger. Now, if the lateral two lumbricals are paralyzed, patients will not be able to form flexion. They'll not be able to close this part of their hands in. And there would be also permanent hyperextension because of the unopposed action of the extensor compartment. So that's why in ulnar nerve you'll find the patients have extended metacarpophalangeal joints. But what goes on here? Why is there flexion here? Now the proximal interphalangeal joints, which are these, are supplied by the median nerve. The muscle that acts upon these two joints is called the flexor digitorum superficialis, which is a muscle found at the anterior aspect of the forearm. This muscle is fully supplied by the median nerve, so in ulnar nerve palsy, this part will not be affected. Okay. But what goes on here? Why is there flexion of the the distal interphalangeal joints? Well, that's because the flexor digitorum profundus has dual innervation, which is another muscle found in the forearm, and it also supplies the muscle. The muscle is also responsible for flexion of the fingers, but it has dual innervation. The ulnar part, that is the median aspect of the forearm, is supplied by the ulnar nerve. The lateral or the median aspect is supplied by the median nerve. The words are very confusing. So when there is ulnar nerve palsy that occurs higher up the arm, so meaning if there's an injury or there's a fracture of the humerus, some sort of traction deformity that causes ulnar nerve damage higher up in the forearm, then the flexor digitorum profundus will be affected and there will not be any flexion here. But if the injury occurs distal, meaning towards the palm, then the flexor digitorum profundus action would still be intact. So what that implies is that in distal ulnar nerve palsy, the severity of the ulnar claw is worse because not only do you get unopposed action of the extensors because of paralysis of the lumbricals, but you also get flexor digitorum profundus action because this muscle isn't affected. But if ulnar nerve palsy occurs higher up the forearm, then the flexor digitorum profundus will be affected and there will not be much flexion deformity here. So the ulnar claw will be much less severe. So this is lower ulnar nerve palsy, severe clawing. This would be higher or upper ulnar nerve palsy, not so severe. The ulnar claw is also very easily confused with another deformity called the hand of benediction. Now, in the hand of benediction, a patient attempts to form a fist, but when they do this, they are unable to flex these 3 digits. Okay. The reason being, there's a median nerve palsy that prevents medial two lumbricals from acting upon the medial metacarpophalangeal joints. Okay, and there's also palsy at the superficialis muscle, as I mentioned earlier. So they're unable to also form flexion here, okay, at the proximal interphalangeal joint, as well as a deformity at the distal interphalangeal joint. So these fingers are permanently extended. They're like this. They cannot form a fist. These muscles are also affected, the thenar muscles, okay, and thus in ulnar claw, this would be a spontaneous deformity, meaning it is not elicited by a particular action. But in hand of benediction, it is elicited when the patient tries to form a fist, and these muscles prevent the flexion of these 3 digits.